If you had an abnormal pap smear and your provider is recommending colposcopy and you want to know more about it or your options, we got you covered in this episode. Welcome back to the New School OBGYN. My name is Eric Schmidt. I'm a board certified OBGYN, and remember, it matters where you get your information. Please check you're getting your information from reputable sources. Let's talk about what you can do prior to your procedure, besides watching this video, to help prepare yourself for colposcopy. We talked about some of the different abnormal pap smear results that someone can get on their pap smear in the previous episode. But again, I just want to be clear that not every abnormal pap smear results warrants colposcopy or warrants biopsy. And so you need to go into your provider so they can put it all together, including your HPV testing, your cytology, your age group and risk factors, to see if it warrants enough of a risk to proceed with further investigation or just observation and your body healing it with time. Now, there was a time in our profession where maybe we were too interventional when it came to pap smears and procedures associated with abnormal pap smears. 10, 20 years ago. And before that, we were maybe doing pap smears and intervening too often. And so that's why, you may hear people talk about how they got pap smears every year. We don't really do that anymore unless there's abnormalities and we're following them closely. Because again, some of these low-grade changes often will heal themselves like 90% of the time. Procedures and biopsies are for those that have a higher chance not healing on its own and potentially progressing down the road to precancerous or cancerous changes. So how do we figure out if someone needs a colposcopy or biopsies done? Well, a lot of hard-working people collected all this data of all these pap smears and all these biopsies and decided, and made a threshold of if someone has a 4% chance or higher of immediate concern for CIN3+, or basically that's superficial cancer or invasive cancer, that they needed further evaluation. This further evaluation would be with colposcopy, and if the risk got even higher, could be more towards excisional procedures. And so if someone's risk is that higher than that 4%, we choose to proceed with colposcopy. Colposcopy is an in-office procedure. Sometimes it's done just in a normal exam room, or sometimes we have specific procedure rooms for this. In simpler terms, colposcopy is taking a closer look at the cervix with basically a microscope. This is called the colposcope. Now, it's done with an exam, just like you're getting your pap smear done. We use a speculum to look into the vagina and hold the vaginal walls open so we can visualize the cervix. Then, once we visualize the cervix, we might put a solution on the cervix to help us to find where these potential abnormal pap smear results are coming from. And so we're looking at the cervix, which kind of looks like a little donut, and there's this zone called the transformation zone, where the cells of the cervix are naturally changing from one cell type to another, but this is also where the mistakes can be made. And so we're applying that. This is now a vinegar solution to that area, helps turn potential areas that may need a biopsy to a whitish color. And so if we find this, we might do what's called a biopsy, okay? There's also another solution that we sometimes use. It's an iodine-based solution. So if by chance you have an iodine allergy, please let your provider know. That can be a very serious allergy. And so this is called Lugol solution. It is an iodine solution, which we also paint onto the cervix, helps us to tell any of these abnormal cellular areas that might need biopsies. Again, if we're not finding any abnormalities and someone has a lower grade pap smear, we're likely not going to do a biopsy. But if by chance we're visualizing something that might be of higher concern with the colposcopy after putting one of the or both of the solutions on, we will likely want to proceed with a biopsy. Now, these biopsies are very small. I like to explain it to patients. It's like the tip of, like the ballpoint tip of a pen. And so these are small biopsies. However, we always want to take into account someone's pain and discomfort in a procedure. And so we'll talk a little later about how we can make this procedure or potential biopsy better for you. And so we might choose to biopsy one or potentially multiple areas depending on what we find. And then if we're not finding an abnormality that's obvious, is if we have any concern that a lesion, again, if the cervix looks like a donut, on the inside of that canal, there could be abnormalities hiding. And so we can't really biopsy that with the biopsy device that we use. And so sometimes we might need to do a brushing or scraping of that inside lining. Again, that sounds pretty uncomfortable, which it can be. We'll talk about ways that we can hopefully make this better just here in a little bit, so stay tuned. But that's called an ECC, endocervical curettage. Okay, now we've finished potentially doing those biopsies, and the area usually does bleed a little bit, and so your provider might put on a solution called Moncell's, and this is kind of this mustard and colored solution that helps the bleeding to stop, or might use what's called a little silver stick to help any bleeding that might come from this area. And so we just warn patients that if you do that, you might have a little bit of abnormal discharge for a few days, maybe even a week or so. And then listen to your provider. They might give you pelvic rest restrictions, or basically not inserting anything into the vagina, whether that's tampons or sex, for potentially a few days, or whatever your provider says. Let's talk about how we can hopefully make this procedure better and more comfortable for each individual. Now, I would say that by far a majority of patients with this procedure without anesthetic do quite well with these type of biopsies. Describe it as a dull pinch. Again, that's them saying that, obviously not me saying it from experience. And so most patients do quite well. However, there are options to try to make the experience better. And that would be pre-medicating with medications like ibuprofen or NSAIDs. If you can take those medications, this might help to decrease the cramping during and after the procedure. Another option is if there is a lot of anxiety heading into the procedure, you can certainly talk to your provider, because usually decreasing the anxiety can make the procedure and the perceived pain go a lot better. And so there could be certain anti-anxiety type medications that can hopefully help with this, but also just talking with a patient, making sure they understand every single step that you're doing has been shown, not only in my own practice, but in studies, to decrease perceived pain during the procedure. So anesthetic options that you might have during your procedure, there could be a couple. If your clinic has access to nitrous oxide or laughing gas, this can help to decrease that pain sensation for some patients. And so you can inquire about this to see if your office has that. We can also inject numbing medicine or local anesthetic into the cervix. Now, there's a couple points I want to cover regarding this. A lot of times, if we're just doing 1 or 2 biopsies, actually the pain perceived with injecting a numbing medicine into the cervix, because you have to remember that's a needle, can be equal or potentially greater than the symptoms of the biopsy itself. And often when we inject numbing medicine into the cervix, there can be some systemic symptoms around in the body, whether it's ringing in the ears, metallic taste, the feeling of or pressure on the chest, and it also gives kind of a feeling of anxiety if that lidocaine and epinephrine is getting into the system. So it is a balance. Each individual patient can advocate for themselves, knowing on whether or not pap smears have been significantly difficult for them in the past. Certainly talk to your provider. I often get the question, is there a topical anesthetic that would work for this? And really, no topical anesthetic has been shown to really give much relief at all. And you really don't want anything to potentially obscure the results, because we are, again, trying to rule out a cancer. Okay, the colposcopy is over, and results will probably take at least a few days to come back, and then they might confirm whether it's a low-grade or a high-grade lesion. Individual results vary a lot, but often if somebody has a low-grade finding on the CIN, so it's like a CIN1, often what we're doing is repeating pap smear in a year from there. Now, if someone has a CIN 2 to 3, we'll likely be talking about in the next video the excisional procedures. This would be, like the LEAP procedure or the cone biopsy procedure. Stick tuned for that video. We'll cover all of that, because you do have options when it comes to that also. Again, hope you have a great day, everyone. If you have questions, write them below in the comments, and like this video, send it to a friend if you know it might help them out. And so it is a balance. And so each individual anxiety